Hospitals are supposed to make you better, but more than 5,000 people each year die from infections that they catch in hospital. Infections like MRSA. It's a huge public health problem. 2 weeks ago, Health Check initiated a unique experiment. You may have seen it reported in the papers. It may help the fight against hospital infection. Far from a sterile sanctuary, our hospitals are being colonised by a plague of superbugs. Nobody really knows where they come from or how to get rid of them. Here at St Thomas's, we're taking part in an experiment which could reveal one source of transmission that is helping this epidemic to thrive. The main culprit is a lethal bacteria called MRSA, methicillin-resistant Staphylococcus aureus. Normally, it lives harmlessly on the skin, but once inside an open wound can cause infections that can't be got rid of by antibiotics.
It certainly is becoming a serious problem. There are patients going down with serious infection in our hospitals. The sort of strains that we have in this country are epidemic, and they spread very easily from patient to patient. It's a clever organism. Historically, it's always gone for the weak. Patients get surgical wound infections, pneumonia, urinary tract infections, even infections of the heart, and they can go on to get blood poisoning.
As many as 1 in 10 people going into hospital can expect to be infected. You're especially vulnerable if you've had an operation which leaves any kind of open wound. Last year, Olive Clark was diagnosed with breast cancer. While she was in hospital recovering from a mastectomy, she caught MRSA.
6 days after the operation, I felt very ill and I had a high temperature, felt very shivery. My wound was infected with MRSA. It was red and inflamed and the incision wouldn't heal. But the worst was that my chemotherapy was delayed by about 8 weeks.
Although Olive Clark has made a full recovery, MRSA is often fatal. 2 years ago, Lord Jerry Fitt's wife Anne went into hospital for observation after changing her asthma treatment. Within 48 hours, she'd contracted MRSA.
On the Saturday, I went up to see her and she was concerned. She said there was a woman at the end of the ward and they had the screens around her and she had heard them saying that she had got some hospital bug and they were very concerned. And I was very concerned when I heard that too. I put my hands to my head and I said, Anne, if there's a hospital bug in this ward, you're going to get it. They put her into an isolation ward the next day and it was just a total steady deterioration.
MRSA weakened her system so much she died 6 months later from flu.
I had one of those very few marriages where we had 48 years of a very happy relationship. And I keep asking myself, had she not gone in for the change of regime of tablets, you know, would I still have her with me today?
The only treatment that is effective at fighting MRSA is a powerful drug called vancomycin. But already in Japan, new strains of MRSA are resistant to even this. The only alternative is to prevent the disease from spreading. Research shows it's carried on equipment like stethoscopes, drips and catheters, but the main route of transmission is hands. Doctors, nurses and medical staff inevitably spread infection between patients. That's why all hospitals have a hand-washing policy. But there is one simple thing that is constantly exposed to bacteria that nobody's thought of yet: the doctor's pen. Health Check asked microbiologist Professor Gary French at St Thomas's Hospital to test 50 pens from doctors and nurses. He put them in a sensitive solution to see what was there. The results showed a quarter of the pens tested for MRSA had the bacteria on them. In one ward, as many as half the pens were infected. Using a fluorescent dye, Professor French showed how the pen then spreads disease.
Let's suppose that this dye is MRSA, which is like picking up MRSA from an infected patient. And we can see under this ultraviolet lamp that the dye is fluorescing.
You are infected.
That's right. If I then finish examining the patient, pick up a pen and write some notes, put the pen down again, I may wash my hands, but somebody else may pick up the pen, such as yourself.
I've borrowed
you put
that.
the pen back again,
right.
Now, if you put your hands under the UV lamp, you can see that you have picked up
Exactly
the
where the pen
infection
was.
from the pen that was originally on my hands.
The results have now been published in The Lancet, one of Britain's top medical journals. We took a copy along to the experts to gauge their opinion.
It is worrying that I think it's so easy to recontaminate your hands even after touching an innocuous subject such as a pen. And I certainly think it means that in places like ITU or our neonatal unit, we should probably allocate individual objects such as pens and stethoscopes to each patient to prevent cross-infection.
And now, as a result of our investigation, both Guy's and St Thomas's hospitals are going to allocate individual pens to patients in high-risk wards, such as specialist baby care and intensive care units. John.